Our conversations to close out this month of Breast Cancer Awareness Month, brought to you by Marcus & Mack, a law firm representing injured people. And we're talking this morning with two doctors from the IRMC Cancer Center in partnership with UPMC Hillman Cancer Center, Dr. Gopala Ramineni and Dr. Boriana Kamenova. Let me press a couple of buttons and get them on the air with us. Good morning to both of you.
Good morning.
Good morning.
It's good to have you both with us here today, Dr. Ramineni and Dr. Kamenova. Dr. Kamenova, let's start with you. I was just this moment, or a couple of moments ago, reviewing last year's conversation with you during Breast Cancer Awareness Month. You are a medical oncologist, and I wanted to start with that, with the fact that a medical oncologist is, it's different from other types of oncologists. Could you explain what that difference is?
So we usually work as a team to serve our patients. We're a team of three usually, the surgeon, the radiation oncologist, and the medical oncologist. We provide the medical care. We provide coordination of care and treat the patients with various hormonal immunotherapy and chemotherapy. The surgeon provides the surgical care, and the radiation oncologist provides the radiation.
And that team approach is very much necessary in treating breast cancer, isn't it?
Yes, that's a must. And also in the team we include the radiologist and gynecologist and obviously primary physicians. But when we make decisions about the cancer care, we get together usually as a team in the tumor board, and we review pathology and radiology. I should not forget pathologists also who work very hard to define the type of cancer, and on this data we advise on the best treatment.
Dr. Ramineni, let's bring you into this conversation about the team approach to treating breast cancer. I know that it's not just breast cancer that is treated in such a way, but we want to focus upon that. That team approach enables you to really go at it from a lot of different angles, does it not?
That is correct. I was writing down about, what to talk, and one of the first words that I wrote down is multidisciplinary approach. What is multidisciplinary approach? As Dr. Kamenova said, it takes a village to raise a child. The same way it takes a team to take care of a patient to get her on the path of cure. Breast cancer is a devastating diagnosis for all women, and we have surgeons, radiation oncologists, medical oncologists, and now we have the radiology that's excellent here that can do MRIs and MRI-guided biopsies. We've got excellent supportive pathologists. We've got genetic counselors. We've got nurse navigators to help patients navigate through this process. So really, I wasn't kidding when I said it takes a village to take care of a breast cancer patient too. So all of these, I'm proud that we are able to offer here, social worker, dietitian, all of these are available right here in your backyard.
And that's a very, very important thing for people to understand about the IRMC Cancer Center is through that teaming up with the Hillman Cancer Center, it's a better treatment course than has ever been offered before here in Indiana at the Indiana Regional Medical Center.
That is correct. I started here about 11 years ago. And if I needed an MRI, I had to send the patient to McGee to get an MRI. If I needed an MRI biopsy, I needed to send the patient to McGee. And if I needed special types of radiation, I needed to send the patient to McGee. If I needed genetic counseling, I needed to send the patient to either West Penn or McGee. Really, we're able to do all of that right here at this moment. So I'm very happy to be a part of this team. And we're actually in the process of getting accreditation with National Breast Cancer Alliance, and that's what Dr. Clark is working on. So hopefully we'll get that certification that validates the great work we do.
Absolutely. Dr. Kamenova, in our conversations with Drs. Clark and Villamoria this month, they have talked about how breast cancer can be something that rapidly advances through a body and affects other organs. And so that really underscores the importance of an early diagnosis. And this is really something that, thanks to the advent of so many technological advances here in Indiana, is easy for a woman to do, isn't it?
So the mortality of breast cancer has been decreasing in the latest years, and this is both because of the better screening with mammograms and MRIs, and also because of the better systemic therapy. So a rapidly advancing cancer is not a death sentence nowadays. With proper chemotherapy and hormonal therapy, as well as radiation and surgery, most of the women are cured. So we should not forget that more and more women are being cured from very aggressive cancers. We have very advanced, very potent chemotherapy, immunotherapy, and hormonal therapy for women whose cancer has spread, and even they can enjoy many years of very comfortable, productive life.
So that early diagnosis becomes extra important because the earlier you catch it, the less chance it has of affecting other organs within your body, and the better chance you have of survival, even with all of the technology and the medical expertise available now. Catching it early is still the best thing that somebody can do.
This is absolutely true. Currently, our recommendations are still...
We're losing Dr. Kamenova. Dr. Ramineni, maybe you could pick up that conversation.
So, what Dr. Kamenova was mentioning about the current recommendations, any woman older than 40 should start screening. And if they have a family history, say Jane has mom who had breast cancer at, let's say, 40, maybe Jane should start screening at even earlier age, say 30, and definitely annually for any woman older than 50. So that's the current